Hi, today we're going to talk about the usage of a neck orthotic. So here we have an apex cervical orthoses, and for different size necks we have different partitions you can remove. So I have a large neck, so I'm going to use this whole thing. If you remove two, you could have it down for a child's neck or for more of a medium adult size neck. Okay? So things to remember: the long side of the curve goes up against the shoulders, the short side of the curve goes up against the back of the head. Okay? So today I'm going to use the bench for ease of being able to see me. You want a firm surface to use it on, so I recommend either the floor or a bench. A bed will have too much give in it, so it'll sink down in and you won't achieve the stretch that you're looking to have. So I'll lay down to start, and what you want to have is your knees bent and your back flat on the surface that you're laying on. And then you take your orthotic and slowly push it down to the point where your doctor describes the loss of curvature to be. So typically we'll see it in the lower neck to mid neck. And so for that, I suggest pushing it down to where it's basically touching the shoulders, and then the head and neck will drop back, and we just suspend it here with gravity pulling down on the head, putting a gentle push up into the neck, creating an extension of those joints. Closing down the back of the joint, opening up the front of the joint, a nice gentle stretch. So things to remember are, initially we only want you on here about 3 minutes a day, and then so long as there's no aggravation, you can add a minute each week to your daily stretch, and you'll do that all in one go. Some patients who have an alordosis or a loss of curvature, or even a reverse curve, which we call a kyphosis, find it uncomfortable to go 3 minutes in one go, so they'll break it down into 30-second intervals and do several of those throughout the day. So things to remember would be, I want you on here 3 minutes, not 3 hours. Don't fall asleep on it, okay? And the other thing is, when you're coming up, because your neck's in full extension, I don't want you to flex over this like you're doing a sit-up. It'll aggravate those joints. So I want you actually to roll to the side and come up. And that way there won't be any stress on those joints. And that's a low-tech solution to a real problem that we see in the neck today.